Hello and welcome back to Taking Control of Cancer, the podcast brought to you by the North East London Cancer Alliance. I'm Steve Bland and we're back in Canary Wharf for this one because we're talking about how the Alliance is developing a world-class workforce strategy to help change lives here in North East London. Before we get into all that, I should say that we're now being played on Bedrock Radio, on DAB digital radio, and in local hospitals across North East London and South West Essex. If you're listening now on Bedrock from your hospital, hello, and thank you so much for joining us. My guests for this episode are Dr. Angela Wong, who's the Chief Medical Officer here at the Alliance. Hello, Angela.
Hello, Steve.
We have podcast veteran Sarita Yaganti, who is the Programme Lead for Personalised Care here at the Alliance. Hello, Sarita.
Hi, Steve.
What's
Hi,
this,
everyone.
like your third, fourth?
I know.
Yeah. And we have Yvonne Beadle, who is the Workforce Programme Manager, again from the North East London Cancer Alliance. Hello, Yvonne.
Hi, Steve. Hi, everyone.
Hello. Thank you all so much for joining me. Obviously, this is really, really important. And, my wife works in NHS. I know how important, workforce is. Angela, let's start fairly broadly. Could you make the case that of all the things that we talk about, having a happy, motivated, talented workforce, investing in people could actually be, one of, if not the most important thing in terms of patient experience, improving outcomes?
Yes, I completely agree. We have cancer caregivers throughout the whole pathway from primary care in the community right through to a suspicion of cancer, coming through diagnostics and then treatment in hospitals, and once their treatment's completed, the return back to community. So throughout the pathway there are multiple caregivers for cancer. And it's really important that staff who deliver those pathways are motivated to do so and feel that they've got enough of them to deliver the care.
It's so important. Yvonne, before we get into why and what the strategy is, what are some of the big workforce challenges that we have here in North East London, particularly here in North East London, but more broadly as well, workforce challenges in the NHS?
Well, we're very aware of some of the national challenges there are in particular workforce groups. There are challenges around some of our diagnostic workforces which impact on our cancer performance. And we also have an ageing and retiring workforce, particularly in areas like our nursing workforce and in primary care. So we really need to think about the kind of support that we're providing, the retention programmes that are developing to keep those people in work in the NHS and working with us, but also then thinking about our pipeline and how we're attracting people into cancer. I think the other thing is that cancer is seen as very specialist, so it's important that we think about how we give our workforce opportunities to experience working in cancer and what that can be like and how fulfilling that can be for people as well.
It's seen as being quite specialist, but is it, or can you come into this area of work, from different parts of the NHS?
There are lots of different routes in and lots of different roles, as Angela's just said, that are involved in a patient's cancer journey and their pathway. And actually, 1 in 2 people will experience cancer, will have a cancer diagnosis. And so every part of the workforce, whether you work in cancer or not, is going to come into contact with those individuals. So, even if you're a receptionist at a GP surgery, or you're a porter that's working in a hospital, you are going to come into contact with those individuals. So I think having an awareness of what that means for the patient and what support and your role within that is really important.
Thinking from the patient point of view, Sarita, how important is, we touched on it a bit with Angela, first question, but how important is, the work you're doing with the workforce in terms of the experience the patient gets?
It is hugely important. We have a lot of feedback from our patients. As most people know, North East London is hugely diverse. And a lot of times people want to talk to somebody who understands where they're coming from. So whether that's culturally, whether it's the different languages, whether it's different neurodiversity, but it's that connection between the patient and the healthcare. But I'd like to also give a massive shout out to our unsung heroes, who are the carers, that, you know, in one way they make up that cancer workforce. They're not specialists, they're generalists, but they've got what we're trying to do is put the patient at the heart of everything that they do. So working hand in hand between the specialists, the generalists, and all those massives of armies of unpaid carers, I think together, if we can really think about what the patient is going through. So at the point of diagnosis, you know, hearing that diagnosis is one thing. So hearing it from somebody who's got compassion, who's got empathy, and the way that that diagnosis is given could help shape that patient's journey and their experience and their trust or mistrust with the NHS and all the other healthcare people that they come across. So it's hugely important. And when we're thinking about developing an education and training, it's that lived experience from people that should and will help shape some of the, you know, either the courses or the tools or resources to really communicate in a way that is efficient for the patient, effective for the patient, and helps to provide that confidence for the patient to know that their journey starts correctly and it will continue along with that kind of impactful kind of touch points with different healthcare professionals, as Angela mentioned.
And
so I was going to say that awareness from all caregivers within, all staff within the cancer pathway is really important. And we take feedback at our Cancer Alliance board. We bring a patient story at every board, and, you know, it's often interactions with staff, perhaps unintentionally, that might then make a patient feel, oh my goodness, because they said this at a scan, I sort of had breaking bad news at the scan, and then we'll have a whole worry over, you know, the intervening time from the scan to actually their hospital appointment, and it's almost breaking bad news inadvertently without the whole support infrastructure. So the more that we can support all staff who deliver cancer care, the better.
What's prompted the need for a new strategy? I presume it's not the first time you've kind of sat around a table and figured out, you know, what to do about the workforce, but what's prompted, you know, this need for a new strategy now?
I think that we know within the cancer plan that's recently been published that the cancer incidence has actually gone up by 10% since 2015, as 15% actually, apologies, since 2015. So that's a significant increase in the number of patients being diagnosed with cancer. We've already, from historical data, know that we've got certain pockets of, you know, significant infrastructural deficit in the workforce. So this was an opportunity to not only stock take and support a prioritisation, understanding that, you know, we know that there are financial constraints and we know that there are some national, shortfall in numbers in certain specialties. So it's for us to take that, to support business cases where appropriate, but also to allow that opportunity to innovate and look at different roles. And I think one of the examples that has happened through work through the Cancer Alliance is developing, for example, clinical endoscopists rather than necessarily having medical endoscopists. And again, through cancer, you know, developing the stratified follow-up so that not all patients have follow-up, but have a follow-up appointment if they need it, and by reducing that follow-up capacity, creating new capacity. So that product increase in productivity and efficiency of the capacity we have has also been really important.
Can I add to that, Steve? I think there have been pockets of work that we've been doing across all of our programmes that have a focus on workforce, as Angela's just described. But we haven't had a kind of overarching strategy that's pulled that all together and that's given us, both us in that work directly in the Alliance, but all of our stakeholders that we work with as well, that kind of oversight of all of that work and the direction that we need to go on to ensure that our workforce is resilient, is developed appropriately, is innovating, etc. over the next, in the next immediate kind of 12 months, but also in the longer term over the next 5 to 10 years as well.
And I guess it gives the workforce it shows them that you're actually making their well-being and their development a priority too.
Yeah, absolutely. Otherwise, it's just kind of it's unsaid, really, isn't it? We might be doing stuff, but actually, we're not talking about it as an overall strategy.
Here we're showing that you're actually being cared for and looked after. Is it difficult, though? Angela mentioned, financial constraints, and, we know about all of those. Is it difficult to find the time, the resource, to put into something like this? I imagine if, there'd be some people, maybe 10, 20 years ago, this might have been an area that went by the wayside if some of the same constraints existed then. Is it difficult sometimes to find the capacity in lots of different ways to focus on this? And actually, that's so important, obviously, but is it difficult to find that?
I think I think if you're frontline staff, if you are working and seeing patients day to day, I think there are huge kind of operational challenges that make it really difficult for them to actually take a step back and think about the kind of what they could be doing with their workforce to kind of ease some of those challenges. It's really hard, and I think that's why it's so important that an organisation like ours is able to support with that, to do some of that kind of strategic work and thinking, to then help direct and pinpoint the priorities for those that are working, for all of our stakeholders, and direct that where we're going to have the biggest impact to make the biggest difference for those people on the front line.
I think it was also important sort of accessing benchmark data. We have X number of staff for this specialty. What does it look like elsewhere? Just to understand where we're at.
And I think the strategy, one thing that we were very clear on, or the strategy behind the strategy, so to speak, is that it's live. It's not like, it's been published or be launched in April and then that's it. We want this to be kind of a living and breathing kind of piece. What we also want is that engagement. So just because something's written on paper doesn't mean that that's it. Written in paper, no further engagement. We built it in a way to get that ongoing kind of input. So we've got a strategy. What does it mean for you? And when we talk about the Alliance, it's not just us and the management team, the Alliance, it is all of that workforce out there, whether it's a specialist or generalist, as we mentioned before, community, hospital-based, unpaid carers, paid carers, there's a whole host of people. But we want to continue inputting into it and really understanding what does this strategy actually mean, what are some of the levers that it can give to help sustain some of the workforce that we have, to reduce some of the gaps that we already know is in existence, and also to make North East London like one of the best places for people to come and live in. We also want to promote the area as well. Yeah. It is fantastic. It's so diverse. I've learnt so much working in North East London in the last 5 years than I've ever had the privilege in other places.
That's a really good point, isn't it, about how fluid this has to be? Because I imagine if you looked at this in 2 more years' time, some of the challenges would be completely different for the workforce compared to now. So is this just really a starting point, and then it continuously evolves?
I think so. And, the national team are going to be publishing their sort of workforce plan that will come out later this year. So we'll obviously look at that and iterate our model. And I think, one of the things we've tried to look at in that sort of innovation space as well is to think about, are we just trying to sort of increase like for what we think it should be, sort of scaling up, 15% increase in incidents? Do we try to scale up by 15%, or can we go for 3% because we've brought in sort of the AI and digital enablers that will support us, as well as, care in the community and working with neighbourhoods?
What role did the actual workforce play in the creation of the strategy, and also what were some of the big themes that came from them?
So, we've had about 12 months worth of engagement with all of our workforce across North East London. So just the kind of that development has been a big piece in itself. So we ran online surveys, we ran workshops, we ran focus groups, we had one-to-one interviews with kind of key leads in various professions and workforce roles. We engaged with the ICB, who also have a kind of overarching workforce strategy. We attended team meetings, we did presentations, we attended board meetings, so that it's been a huge piece of work kind of engaging everybody within that. We're kind of officially launching the strategy at the end of April, and we've invited all of our stakeholders along to that. And there will be kind of activities within that launch where we're asking people to reflect on what the strategy is saying, and whether that kind of mirrors their experiences, but also what they can do as individuals and as teams to deliver on some of those actions and those priorities as well. So it's been very much a kind of co-production piece.
I think in areas where a department may have been putting in individual business cases because they've mapped what their shortfall is to deliver for today. We've not necessarily replicated that. I mean, we've let that continue and fed that into the plan rather than trying to duplicate everything or try to do the workforce for everything. So there's been very much a phased approach.
And I think as we were saying earlier, as Sarita was saying, this will iterate, this will develop. There'll be work that will come out of this that will need to kind of change focus or change direction on slightly, depending on, external levers and what happens in the external environment. But there will be different people doing different parts of it. We've talked about developments within the neighbourhood models, and so what do they need to be doing around supporting cancer patients? The cancer plan talks about the role of the CNS as well, and the importance of that within a patient's journey. So we'll be looking at, how we support our nursing workforce. Talked about challenges in primary care, and so there'll be, and that will develop over time as well. So it will definitely kind of iterate. This is the starting point.
I know because my wife works as a nurse in the NHS. I know what a tough job it can be. How have you addressed? I guess this is maybe a little sneak peek I'm asking for of what's coming end of April. But how big a part, or how have you addressed staff well-being as part of the whole strategy?
We have, in one sense, but that's definitely the kind of the tandem that we're looking for. We know that a happy workplace kind of helps with that retention. It gives people kind of the sense of accomplishment as well. We also know how overwhelming the healthcare system is at the moment because of multiple different reasons, and especially as reality fits in. So yes, motivation is really key. How we keep the workforce happy is another challenge, and I think this is where we work with our kind of our partners in this. We have. We're going to be relaunching or kind of expanding our Cancer Academy, so which will kind of help with that confidence level. And we've recently done, as part of the strategy, kind of deeper dives into kind of the nursing communities as well as the AHP communities, and kind of understanding how they are currently, and using that kind of recipe. Would like to extend that out to all the other key other key work groups, especially those that we know that might be slightly more fragile, as Yvonne said, when we've got a more of an ageing workforce. But as we've got an ageing workforce, we've got a future workforce coming in, and their motivations might be very different. So again, we need to learn with all those people that are kind of coming into the system as well, and we have to keep evolving.
And I mean, there are particular projects that are already running at the moment. You had a podcast just the other week about the Cancer CNS Development Lead project. So that's an example of things that we're doing already to kind of support our early career nurses. The stats show if a CNS stays in role for 2 years, then they will stay in that role for life, for the rest of their career.
Wow.
So, but there is a big drop off in those first 2 years. Yeah. So that's why we've invested and supported in this particular role that supports those early career nurses to really give them the kind of skills, the confidence, the mentoring to help them really flourish in those roles. And it'll be things like that we'll be looking at and looking to develop in other parts of the workforce as well. I think the other thing that we're quite keen to do in the future as well is to, as Sarita mentioned, look at our kind of local pipeline, to look at developing our local population, or look at opportunities for employment within the NHS within North East London, and that that provides two benefits really. It's about kind of employment for the local population, but it's also ensuring that our workforce, our healthcare workforce, looks like the patients that they are caring for and supporting, and that's really important for our patients as well. So I think it's opportunities like that.
I went away last week for a little night away to a restaurant called Long Clume in the Lake District. I don't know if you've ever heard of it. It's a beautiful restaurant, one of the best restaurants in the country. It's absolutely amazing place. And I was watching the staff go around, and they were so well drilled. And part of the charm of the place was how they were all completely driven to do the same thing, to offer the same service, to be. There was nobody standing around. There was one point where a guy walked up to the table, and I watched him on the other side of the restaurant. He was chatting to the people at the table, and he picked up a plate and he held it behind his back, and someone else just walked behind him and took it off him and walked to the kitchen. Everybody was so well drilled and so on message, and so motivated to push towards the same goal. And I know that's 50 people or 100 people in a restaurant compared to the thousands of people that you guys have. But how do you get a workforce all going after the same thing, all motivated to achieve the same thing, to have the same standards?
So I think, for example, in the CNS development programme, there was a presentation about the overview of all our programmes of work and describing the vision, the common goal, and I think that really helped on board everyone on the call as to what the programmes were, but also given the opportunity to get involved in projects.
And that's why you have a strategy, isn't it? So that everyone has that common vision about what needs to be achieved and the direction that we're going in, so everybody kind of works towards that. And I think, anybody that works in cancer or in healthcare does so for the love of it. Yeah. We talked about how challenging it can be. So, but people still choose it because they want to care for people. They want to offer support. It's really important, I think, to people that work in this industry. And so it's, part of the strategy is about really enabling that, so that people can care and can give the best care, because that's what drives and motivates individuals to do the best that they can. So it's, looking at all the different enablers that a strategy can provide to really, get the best out of people.
And making people feel valued as well, Sarita, isn't it? Making people feel that the efforts they're putting in, the crazy long hours that they're putting in are actually being recognised and valued.
And I can imagine it can be, a thankless job, because you're either breaking bad news or you're trying to manage somebody with very complex needs. And, certain healthcare people might walk away from that thinking, have I actually done anything to help that patient? So it's how do we then support those that are doing their ultimate best to help those that they are, employed to help? But it's that peer support, I think, and what we want through the strategy is to kind of develop that. We don't want people to kind of struggle in a silo. We are an alliance. We are all joined together with the same purpose of providing the best possible service for our patients, the best possible treatment that we can possibly afford within our patch, and the best outcomes for our patients to help them to live better and longer after their cancer episode or their journey. Not just them, but those around them as well. So I think by that peer support, I think that's probably one way that people can really fully understand my day, if somebody knows my day and has walked a day in my shoes, to really understand, and then I can kind of, feed off each other on that and support each other. And I think it's that supportive workforce, Yvonne. We were talking about this quite a lot, weren't we?
And I think that's really important. There are already examples of things that we're doing like that. So we brought together our AHP workforce last year. We had a CNS event. We've got another kind of cancer nursing event planned for next year. We're talking about what we can do with our assistive and supportive workforce as well, to bring everybody together to support each other, to provide that peer support, but also to learn from each other and to recognise achievements. achievements and to celebrate those as well. I think it's really important that we do that. And that's another way that people feel valued and connected around that common purpose.
Are compulsory lunch breaks part of the strategy? Because I speak to my wife. She come home from work, and I was like, "How was your day?" And I was like, I'll tell her about the great lunch that I've had because I'm quite a foodie, and she's like, "Oh, I haven't even had a minute for that." And I think something like that it's a small thing in a sense, isn't it? But actually, in terms of well-being, actually, making provision that people can take a lunch break and can take even just 20 minutes.
I think part of this process has been through meeting all the stakeholders, hearing about, what the number one frustration might be. And again, with that sort of Cancer Alliance hat on, thinking about, is there something that we can implement that can bypass needing to answer the phone all the time, for example, to allow those breaks.
And I think it's about instilling within kind of local leadership, within your team leaders, your service managers, kind of developing them as leaders so that they are setting the culture within their teams and within their workforce about and understand what looking after the benefits of looking after your team and your and your workforce, the benefits that you will reap from that, that they're saying, take your half-hour lunch break, go for a walk in the sunshine, do what will refuel you for the afternoon ahead.
Yeah, that's so important, isn't it? The buy-in from everybody with this.
Yeah, I mean, we can dictate everyone takes a half-hour lunch break, but if actually your line manager is saying, no, you need to do X, Y, and Z before you stop, it's that's not going to work. We need to empower and develop our leaders
and educate them to understand why these little things are important. We talk so much in this podcast about the diversity of the patch, the health inequalities that we see, or that you guys see, day to day. How does this strategy work to support that goal of removing those inequalities?
I think it's access. I think it's having access to the right people who can talk in the right or the correct way, or the way that people can understand better. I think our workforce, every person that I've come across seems to understand the needs of our patch. I haven't met a single nurse, medic, generalist, specialist who doesn't have that patient care at the front of everything that they do. The way that, for example, a cancer diagnosis is given, no matter what ethnicity anybody is, the person given the message or receiving it should be given in a way that as a human should be in the most appropriate, with empathy, with compassion, with a moment pause so that the news kind of sinks into the patient. And then just re-emphasising that support is there for that person as they go through their journey. But who and when,
I think looking at data is really important as well, just for us to constantly look at, how are we doing in the Cancer Patient Experience Survey? How are we doing in terms of access from an inequality lens, so by age, by ethnicity, by protected characteristics? And I think that helps us then, take a look back as what do we need to do to reduce that unwarranted variation that actually does exist.
And we're actually doing a piece of work on the cancer care reviews, which is a really key part of a really key appointment, I should say, for a patient with their primary care provider, whether it's with the practice nurse, a primary care nurse, or the GP. But it allows that patient to talk about how they're feeling and what matters to them at that point. Now, we know that appointment might be giving at the wrong time. There's quite a few kind of issues that we're looking into, but we're doing a big kind of reflective piece on it. So asking the practices, you've done all of these cancer care reviews, let's think about what the quality is and having that honest look into it. So perhaps that reflective piece is something that, as whether you're a manager or a health provider, healthcare professional, to really reflect on what the last conversations you've had and what could have been a bit better, what was the reaction from the person that you were talking to. But using that reflections perhaps for their own personal development might help.
There's definitely something around, certainly within the strategy, there's something around kind of education and training. And I think kind of key to that is, as Sarita was saying, is around good communication skills. I think there's also something about, what you were saying, Steve, is if we've got a workforce that is so overwhelmed, that isn't taking lunch breaks, that kind of is kind of constantly bombarded with stuff, then there is a risk that they will stop feeling that empathy towards their patient and won't communicate well. Yeah. So, kind of the whole package will support those better communication skills and the way that they relate with their patients. I said earlier about looking at our workforce population and where we are getting that from. So if our workforce is taken from our local population, they will look like the patients and they will understand the kind of cultures and experiences that their patients come with. And then, as Angela was saying, looking at the data, so if there are particular kind of issues or particular things that we need to target or to improve in, is then developing specific kind of quality improvement projects aimed in those targeted ways. And alongside this strategy, we've developed a health inequality strategy, and that will help to inform some of that, and will link into the workforce strategy and the other work that we're doing in the Alliance.
Nice little plug for another podcast we did actually on the inequality strategy. Have patients been involved in the whole process over the last 12 months to tell you guys what they want from the workforce?
So they have. I mean, our focus has been on speaking to and engaging with the workforce themselves. But absolutely, it's kind of fundamental to all of this is the experience that patients have and the way that they are treated by the workforce, and how their cancer diagnosis is how they're managed through the healthcare system by that workforce. We ran a patient survey. We had a couple of one-to-one interviews with patients. We offered some focus groups, although those weren't taken up. So most of the intel has come from the surveys and the one-to-one interviews. But then we also reviewed, as Sarita and Angela were saying, our kind of CPERS, our National Cancer Patient Experience Survey results, which is kind of the voice of our cancer patients, and then any kind of local feedback that some of our teams have gathered.
Angela, what does success here look like, and how will you measure it? Is it going to be in the next year, the next 5 years, the next 10 years? What does success look like?
So I think, in the first instance, we'll put sort of 1 year, 5 year goals, and it will be, do we have the workforce to deliver on our cancer constitutional standards? Because that's really key for access. And within that, are we showing less unwarranted variation in access? So I think that's important. We've developed through this strategy, some of the highest risks, and I think despite all the sort of measures that we've described to support the workforce, there does need to be a net increase in certain specialties. I think at one point, for example, consultant radiologists were, really we had 9 per 100,000 in North East London compared to 18 per 100,000 in North Central London. But through the CDC programme and successful bidding within that, we have increased our net radiologists. So these are all, I guess, measures that we can put in the net increase, but also our access. So we'll have a number of measures and metrics that we'll look at that will determine, how this strategy has delivered and will continue to deliver.
And it might be quite difficult to check our retention rates. I mean, I don't know if that will be a useful indicator to see if people are staying in post longer, because life happens, doesn't it? So people leave a job for so many different reasons.
Yeah, but hopefully you might see a pattern start to emerge, mightn't you? If you're working so hard on making people feel valued, that actually maybe some of the life challenges that take people away from a certain job might not be such an important thing.
I mean, I think absolutely there will be kind of key parts to the strategy that we can link to things like retention rates, or to vacancy rates, or to kind of staff patient ratios, those kind of things that will be indicators as to how we're doing and how we benchmark to our kind of the other London alliances. So programs that focus on retention, we will be looking at the retention numbers against that.
And I think it's useful to say that we're still waiting for the NHS workforce plan to be launched in the spring, we think. So there definitely lots of kind of insights that we can use on that. But I was just thinking about people in our patch, and movement between our different trusts and ensuring that there is a free flow of nurses across the different patches, obviously different patients, but again, through the Cancer Academy, I see quite a lot of benefits and opportunities kind of coming to help kind of break down some of those barriers between specialists and generalists. If you really boil everything down to a lot of patients, it's that simple question about what matters to them at that point. You don't need to be a specialist to ask that question. You don't really need to be a specialist to signpost patients to different organisations such as Maggie's or to Macmillan. But it's our role as a Cancer Alliance to make sure that the generalist workforce is aware of those services, and that's what we try to do by promoting through, various different routes, such as our website, through all the information that we provide to primary care, secondary care, and constantly trying to update on some of those signposting. I mean, some organisations kind of close, and the last thing we want to do is signpost patients to something that's not there. So we're really kind of being rigid in making sure that the offers are viable, really.
We have just over a month, as you said, Yvonne, until the strategy is released, end of April. We're recording this towards the end of March. How does it get implemented? If someone's listening and thinking on May the 1st, how does my job day to day feel different? Or, how do I feel differently, about my job? What's the answer to that question? How do we actually implement it so that people feel and see the difference?
Well, there's not going to be an immediate,
So
change.
May the 1st, there won't be much of a change.
No, but it will, over time, I think there will be changes that people will... And in fact, there are projects and programmes of work that we're delivering now that will be felt by the workforce, by individuals. We talked about the CNS development lead and your earlier podcast about the support that CNSs that have gone through that programme have benefited from. And so there will be pieces of work like that. There will be projects and programmes that we're delivering where we'll be looking for input from both individuals and teams and services to work with us on to drive those improvements. But there'll be kind of individual people will be individual beneficiaries of some of those programmes and projects as well. There'll be opportunities for people to get involved. I think I mentioned earlier at the launch day, we will be kind of testing the strategy and say, does this reflect your experience? And, what opportunities and what challenges do you see with the implementation of this? But equally, there'll be opportunity for people to say, I want to get involved in that. This is an area, actually, we're already doing some work on, so can I come and talk to you about that? Or how do we kind of combine our forces across the area to work on this really tricky problem together? So, and the strategy will be owned by everybody, but by, not just those working directly in the Cancer Alliance, but the wider Cancer Alliance involves all of our North East London stakeholders. So it's about everyone taking ownership of that and contributing towards that.
We touched on leaders earlier, Angela. How important is leadership going to be in implementing the strategy? I was thinking about the lunch breaks again. I go back to lunch a lot, but just leadership in general in terms of implementing all the things that you want to do to make a difference for the workforce. How important will leadership be?
I think hugely important, and I think to Yvonne's point is that everybody has the potential to be a leader, to in their own specialty or workforce group to come up with an idea and to implement it with their colleagues. So really important.
What is there a message that we could share with anybody listening who is part of the workforce who doesn't know what's coming in the strategy, who you may be feeling stretched under pressure, uncertain about the future? How, what's the message for them, and how, you've touched on it a little bit, Yvonne, about how they get involved in shaping that future?
Well, yeah, I'm kind of building on that. There will be things at an individual level that people can get involved in. There'll be things at a team and service level, and then there'll be things at a system level that will need kind of multiple stakeholders. I think the National 10-year plan and the cancer plan will also give indicators of the direction that we're going in, and the talk of kind of the role of the CNS, the move to the kind of neighbourhood models, the use of AI and digital are all going to be really important factors within that. So again, thinking as an individual, what's the opportunity for me? Do I need to upskill myself perhaps in a particular area? Let's have a look at what's on the Cancer Academy in terms of training and education, or what peer support offers are out there. I think I'd be remiss in my role as a workforce lead if I didn't talk about the Ascend programme as well. So I'm just going to do a little plug there, which is the Aspirant Cancer Career and Education Development programme, which is aimed at nurses, AHPs and the assistive and supportive workforce. And again, as an individual, kind of engaging with that framework, it's a kind of a career pathway, it's an education and training framework. If you are working with people with cancer, it will help to develop you within your career. It will give you the tools and the resources to think about, the competencies that you need to do your job well. Even if you just go and have a look at that framework and where you sit within it and talk to your manager about it, talk within your appraisals and supervision about how you personally can develop in your role and taking some ownership for that as well. So, I think at all those different levels, there are ways to get involved and that will make a difference to your day-to-day job, both over the short term, but equally over the longer term too.
And if we think about 70% of cancer patients have one or more long-term condition, there's already, loads of other people out there that don't realise they are part of the cancer patient's journey, because they might have seen a patient in a diabetics clinic, but not necessarily talking about the cancer. But this is where we're trying to say that, if patients got more than one term condition, what matters to them is not necessarily the condition. It might be the effects of, but it could be a collaboration of all of those other conditions somebody could have. So it goes back to that holistic approach to people. So, from the very beginning, that training and education, that holistic side of cancer, I think could do with a bit more strength, because it's very medical, very clinical. So, we can all have that. Again, go back to empathy and compassion, because how would I want to be treated if I get that cancer diagnosis, So it's thinking about what I'd like for myself and for my family and friends, that world-class communication, making sure that they know what's going to happen next and how the treatment might affect them. So it's reducing some of those surprises. And the last thing we want to do is surprise a patient with a very poor communicated experience. So that reflection, again, I think if the workforce can really, hold their hands up or put their hands on their heart to really think about what could I have done better for that.
The communication, that I've said this a million times on this podcast. If I think back to, my first wife Rachel's treatment, the communication and a lot of my memories of that couple of year period were of interactions with people who perhaps didn't know how to communicate. And we'll talk about this at the end of April when the strategy's out. But it'd be great to see, a lot of work going into how people communicate with patients, because for me that's just such an important part of the puzzle. Yeah.
And to their families as well.
Yeah.
As you know from your experience.
It's a tricky one, isn't it? Because I felt as I should have felt, to a degree, like I wasn't the centre of anybody's attention. And that's fine, but I would have liked to have felt a little bit more important, I think. And like somebody had an idea of what I should do, or how I could help, or how I should help myself. But that's maybe a whole other podcast. Right, so listen, we're going to come back to this at the end of April. We're going to do a podcast from the event where you talk about the strategy. So I won't ask for too many more sneak previews. we'll come back to it then. Thank you so much, all of you, for talking to me.
Thank you.
Thanks, Steve.